Hi, little birds. It's your girl Jaylen coming back at you again. I wanted to do another subject that I get asked on a lot by strangers, people I work with, friends, not really family, but many people. It's ridiculous. But I guess it's out there, so people are inquisitive, they want to know, and that's all about surgeries. What surgeries have you had? What have you done? And so I did a little research because I myself kind of wanted to know, like, what kind of surgeries there are. I know most of them, but for the males, I wasn't real sure what they have available or what they get done because, well, I'm female, so I know about mine, but I don't know about theirs. Um, so to dive into it, when you ask what surgeries you've had done, it really depends what you're meaning by that. Now, most of us will assume you mean the bottom surgery, but in among transgenders, we have many different surgeries that confirm our gender identity, that affirm our gender. So there are many, many surgeries that, are possible that just affirm what our gender is, who we are, and our body, and make us more comfortable within that our body as well. And I guess one of the older terms is sex reassignment surgery, or SRS. There's also genital reconstruction surgery, GRS, gender affirmation surgery, GAS, which I don't. That term is so horrible just because if you say, "Oh, I'm getting the gas," they'll be like, "What? You're getting gas? Okay, why don't you go take a Tums?" Okay, so I don't know if I agree with that one or not, but hey, it is what it is. Or there's genital reassignment surgery, or gender confirmation surgery, which is the term that I prefer, which is GCS, because it's not reconstructing me, it's confirming my gender identity. So that is the term that I use for all of them. And you can ask any trans person, they'll have a different preference as to what they call them. Now, the easiest way that you can phrase it would be top or bottom surgery. And, most of us have a top or bottom surgery, or one or none, or all of them. It all depends on the person and what they're comfortable with or not comfortable with. So, to go into some of the male ones, now these are I'm not real familiar with. I don't know the procedures that well. I haven't researched them, but I'm sure you can Google all of them and find more information about them if you're interested. I'm no expert by any means, so one of them is a double mastectomy with reconstruction. Now, this is making their chest into more of a male so that they don't have to wear binders and other objects to flatten them and, help them to not appear that they have breasts. And then you can have a hysterectomy, um, medioplasty, or orophorectomies, which, who came up with these terms? Make them easier to say, okay? Really. And then the last one for them is a phalloplasty, which I'm somewhat familiar with. It's basically making your clitoris into a penis, and there you go. And it also involves, as I understand, several surgeries, or you can get it done all at once. It just depends on the surgeon that you get. Um, Now, the ones for the females, You can, there's several that, we can have that help us out with our gender and help us to feel like we fit into our gender role, our gender identity, and what we feel is part of our gender. And each of us has a little different interpretation of that. It's not all cut and dry of, oh, all of us have to have this surgery. It's all different for everybody. So one of them is orchiotomy, which is basically they just remove the testes and that's it. And then you don't have to take as much hormones due to your testes not being there, so they don't make the testosterone. The other one is a breast augmentation. Of course, cis women, a lot of women get this procedure. It's not anything new to anybody. Then there's a cricothyroid approximation, or the voice box surgery. And this is to tighten your cords to make you sound more feminine. Now this one, as I understand, it works sometimes, doesn't work other times, and it's because the cords relax and don't get a great result, or they just grow back out and you're back where you started. So it's kind of a iffy surgery. They're going in your throat and you may or may not get great results from what I've heard, researched. So this is not one that I am considering. I would rather just work on it and see where I go. Then the other one is a laryngeal reduction, or a tracheal shave, or a Adam's apple shaving. So basically they shave it down so that it's not as noticeable. As you know, some guys have really large ones, others don't. So not everyone, again, gets this procedure because they don't feel the need to. And this is one I don't feel personally I need to get. And I just don't feel the need. The other one is a vaginoplasty. So they don't cut off your dick, okay? I just want to put that disclaimer out there. That is not what happens in this procedure. You can go YouTube it. It's on YouTube. There's several people that show how it's done, if you can stand the gore of it, because it's a little bloody. But basically they take your penis, your scrotal sac, and invert it and make a beautiful vagina, and it looks like the real thing to me. I've compared the photos and it's really hard to tell. I can't tell, so I don't know who can tell, but maybe surgeons. The others are facial feminization surgery, which is FFS, and it's a combination of 5 procedures that people can get. Not everybody gets all 5. Now, you might get 2 of the 5, you might get 1 of the 5. It's just according to preference, what you feel is not right on your face, it just gives you bad gender dysphoria. So, and then the other ones that we do that sometimes we talk about and sometimes not is like hair transplants. Some of us are going bald before we do our HRT, unfortunately. So hair transplants, so that we have full head of hair and we look beautiful and luxurious. And then the last one of the other ones is electrolysis or laser hair removal. So some of us are hairy before we take HRT, and so we have to have that removed. And it's also a prerequisite for some of your bottom surgeries as well. So that is some of the surgeries. Now, as far as what I'm getting, I'm not going to share that because I think it's very intimate and private thing, but at the same time, it's a need to know basis, and not everybody needs to know. But if I do get any, or I do get some, I will talk about it on here. I will mention it and bring it up and talk about it, because I think it's important that everybody kind of finds out about it, that they can understand the pain, and the psychological aspects of it, because it is very taxing on your body. As I understand, it's a lot of maintenance, and it just takes a lot out of you, as far as you have to get blood and everything. It's just, the surgeries are not for everybody, and and it's not because they're not available, but it's also because they're very expensive. If you do not have insurance, you're going to pay, I've seen some estimates of $100,000 for all of the procedures if you wanted all of them. Or even if you do have insurance, it's still rather hard to price it out. But most of the surgeons do have their own financial people that they deal with that can fund them. Or you can do fundraisers. There's many different options that can get you those funds for those surgeries. Some, they're just not available in some countries, just because of the religious beliefs and whatnot. I recently saw a program on Pakistan, and they have these religious police that come to everybody's house, and even if you're like in a hotel with your girlfriend, they arrest you. So imagine what it's like for a trans person that would like to change their gender identity, but they have this great fear of these religious police coming after them. So it really dependent on how available and what your means are to get these surgeries. Not everybody has them. Um, so that's kind of my take on the surgeries. And, you know, I know it's not everybody's opinion, so don't kill me. Um, so again, be our authentic selves and do what you believe is right for your body. Don't listen to everybody else. Alright, bye little birds.